This is another patient of mine. She's about 8 weeks out from surgery. You can see the belly button's nice and round. It's healing up really well. I usually have started just having people, unless it looks like the belly button's really constricting down, using the pediatric earplugs from Target. They're the red ones. You can buy them, you can throw them out. It's really easy. And then you don't have a funky smelling, marble or belly button shaper.
Marbles are a little abrasive too if the stitches are still healing.
Right. And then I've had instances where, we make an incision around the blood, around the belly button, so the blood supply is a little bit compromised. And so if you start putting something in there that's really hard and pressing against the skin, it can kill the top layer of the skin, which is a problem. But the pediatric earplugs, they're made for little kids' ears, so they're gentle enough. Mm-hmm. You can see, this is 8 weeks out what the tummy tuck can look like. Scar is all the way inside her underwear. It's very light, and then it's very low down here, okay? This part is nice and flat. Now, this is something that I want to show you. So she actually did not have any fat transfer to the butt area. Move your hands to the front for me, because look, she already has a really nice shape on her own. I personally don't mind a little bit of depression right here. Some people call it a hip dip. She doesn't really have hip dips. Me personally, I like it like this. It looks natural. If somebody does want hips, of course, I can do it. But if somebody wants to keep it natural, longevity-wise, it looks really good if you have the initial shape to start with. So mainly blending. This is my big thing. I really like to blend this area. I hate when there's over liposuction of this area and it creates a big crease across the lower back. Some of that's from the faja, some of it's from just having had too much lipo in an area. If you think about liposuction, if the liposuction is being done from down here, every stroke gets this middle portion twice, it gets this part once. So if it's done too much from down here, it can over liposuction this area. Now, if somebody's skilled enough, they can definitely still do it from down here and not get that, but it's just something to be mindful of. And then, of course, if I'm going to do, she didn't have much upper back fat, you can see from her before photos, but I still take it from the upper back so that I can really curve it out. If you take from here, the fat up top can start to fall over because some of the fat down here acts as a support of fat up there. Now, I'll let Ty, who is really a great expert at this, explain why she has a little bit of fullness up at the top right now during her healing period.
So right above this area, when you think about compression, you have to take into consideration all forms of pressure, internal and external. So you have a heightened amount of internal pressure that's pushing out on this area right here. The faja pushes in on the side, the breast tissue, and then the bra pushes everything down. But then when she's seated, her thighs push everything up. And so it creates a little compartment right here that we call the third boob. It's just a collection of tissue that as you get further outside of the woo is a time frame. It's pretty critical. It's from week 2 to week 6. It stands for window of opportunity. As you get further, and you're about 8 weeks, as clients get further out of the woo, tissue starts to harden, solidify, the collagenous layer the fibers start to harden. And so what I instruct clients to do, even if they have nails, it's okay. You're going to push your fingers into the third boob area right here, push in, and slowly pull apart in a almost static motion. You're not dragging, you're not hurting yourself. You're putting in a level of pressure to counteract the effects of pressures, external pressures pushing in and upwards and down at the same time that your internal pressure is pushing out against that area, and it'll help to break down that area very nicely. Something else that I wanted to point out too, if you turn, she doesn't really have as much definition here, but everyone has natural lines of underlying adhesions and ligaments just through your course of life. And so if he were to over liposuction this here, gravity is pulling on both of these areas. Unless the surgeon were to go in with a scalpel and cut those collagenous adhesions underneath this area, no matter when she gains weight or loses weight, it's going to be above and below this area. So keeping that in mind when he's working on her, when she's compressing, and making sure to try to have even compression on the top and bottom above the natural lines that she has will allow her to heal with a more natural look. But phenomenal work. Are you still wearing your compression?
Yes.
Okay. Now, one other thing I want to point out too, you can turn back this way. This isn't something that's talked about often, but the foundation dictates what she can and can't do to get best results. Because of how flat her foundation is, because she doesn't have any tissue that's bulging above or below her fupa area. If she wanted to, based upon this foundation, she could start wearing a waist trainer and get optimal compression and coverage. Whereas in someone, depending on what is happening below the umbilicus area, they may not be able to. Fajas offer thorough, even MMHG compression from here to here, all the way through the entire torso trunk. Whereas in waist trainers, they have optimal compression right here. Because this isn't her problem area, this is. If you ever opt to wear, I hate the wraparound bands just because they're not good for most people, but for you, it could be. If you wanted to wear a sweatband, a waist trainer, or a corset, corsets do what waist trainers claim to do. Just make sure that you have adequate compression right here and be conscientious of whether it's rolling down on you or not. The goal is to have flat, thorough, even compression from throughout the trunk areas without putting too much pressure on any fat grafts.
Mm-hmm. And then the other thing that I've noticed is, especially if somebody has to sit at work for a long time, if they're wearing their faja, and nobody's typically wearing it incorrectly per se, it's just that when you sit, the design of the faja will cut in it on you right in the center, right here. Whether you're wearing a board or not, hard board's probably better than soft. You just have to be careful with the hard boards, because if you sit and it digs in, you're not going to be able to feel this area very well initially. Especially
after tummy tuck.
Yeah, so you need to have, if you're going to do a hard foam, you have to have foam under here. Otherwise it presses too hard on your skin and can cause necrosis. But then when something is really tight across here, it can make you swell up there, and it can make you swell at the bottom. Now, her garment or pants is giving enough compression down here, but when you sit, it's almost unavoidable. So what other tips do you have in terms of trying to prevent this from over compressing right in the center? Because I see it with some faja alters too, where they alter the faja really quickly. They'll tighten it here, and then people are like, oh, I'm starting to swell above and below it. Well, I'm like, well, it's
pressure, fluid goes where pressure is not, and if you amplify the pressure in one area, all the fluid is going to do is dissipate into other areas. It winds up having a tourniquet effect, right? Yeah. So what I suggest, especially if you have, and it's funny when you were doing it with your shirt, it did it perfectly what you were demonstrating. What offsets it, I swear, I feel like the plastic surgery industry keeps the poise pad company in business. Take poise pads, get the really super thick absorbent ones, and put an extra one right here if you have a gig where you're sitting down throughout the day, to offset and prevent the garment from pursing in. You want something that's going to be soft. And while I am a fan of the swell spots should not be used for long-term wear. They are for temporary correction and spot placement. So a poise pad is thicker than your regular foams. It will help to complement the board, but it won't be so intense like swell spots are, where it can encourage fibrosis and overgrowth of the collagenous layer. And then the other thing, I just had a brain fart I was going to say about that area.
But that's a really good point about the extra, for instance, scar tissue forming in here. And that's why I actually have one of my drains come up here so that no seroma forms there. So that's a really good point. And then I like your point about spreading this area, because I see it all the time. People
You're
put their
pushing
thumb
everything
on,
in.
instead of pulling outward and across, they'll just go straight across, and it pushes
Everything,
this
it
like
bunches.
that. And it can cause some rashes on people right in the center where their skin rubs.
You want the skin to be flat. You want the foams to be flat. You want, even when it comes to the compression tanks shouldn't be bunched up inside of the garment. I tell people to get wickering tanks that are a size smaller than what they normally would wear. And so that'll offset, it'll give extra compression, and it won't bunch up underneath of the skin. Ab board, I am a fan of the wraparound ab boards. However, those the wraparound foams, but they come with an ab board insert. That's a rectangle, which sucks because they probably would only be good on people who are, you look like you're like a size 4, size 2. Yeah, so unless you are in a single digit, she's like, yes, sis, I have to say it again. But unless you're like a size 2 or 4, that little ab board does you no justice, because it's not compressing and adding positive pressure or protection on either side of that little insert. So if you do get the wraparound foam, you still need a regular ab board, even if it comes with the ab board with it. And so that'll help to prevent it as well. And then the average torso length is, I think, 14 inches from, and the way you measure your torso length is from the base of your genitals up to your the bottom of your sternum. So from here to here on her, I'd say you're maybe about 14, 15 inches long. If you have a longer torso, you need to have full coverage from sternum to the top of the pelvic girdle. If your ab board doesn't reach that high, what I'll tell people to do is to get a backboard, an additional backboard that has the point, and put it underneath. So the ordering of layering would be your compression tank, your your backboard that's upside down, your foam, and then an ab board on top. When you are properly compressed and protecting your investment, there's no way that tourniquet effect will wind up kicking in.
Yeah, I've actually taken that tip from you with the backboard on the front.
For longer torsos.
I actually do it on the majority of people because I never want a seroma to form up here. It's very difficult to fix. If it does happen, so I have the drain come up, and then I have that board really compress up here.
Well, you know, seromas are normal. They freak people out, but they're not as bad as a buzzword as fibrosis is. Seroma is just a fluid cavity where something once was. And as the cannula goes in and out of the tissue, air gets stuck in there. You'll have clients who may say that I've been belching a lot or passing gas a lot. The air is trying to find somewhere to get out. If someone develops a seroma, it just means that they need to update and correct their compression.
Yeah, early on, I completely agree with that. Yes, it will definitely do that. And then, but the backboard has been really helpful.
Question: now, if somebody were to have this and you wanted to excavate, couldn't you just go in through their belly button right here and address it? No, it is a hassle, and it can potentially create more scar tissue. But I was just curious as to, because I had clients got seromas at like 6 weeks post-op, and I was like, huh?
Well, they probably had it before, it just wasn't noticed.
It's visible.
I just have noticed, when they don't have adequate follow-up, the seroma cavity can collapse flat, but it will also occasionally cause the skin to roll in on itself.
So something else I just noticed that I want to point out, she actually has, and I know you didn't do anything back here. Did you do any lipo at all?
Yeah, lipo all along the entire back.
Okay. Yeah. So she actually has more of a curvature here. She is still healing, but turn catacorner just like this. This triangular area is because she's been spending a lot of time sleeping on her back. And do you wear a backboard?
I don't wear the back in the front.
Right. So she needs one back here. You have maybe about, I'd say, a strong 2 inches of swelling sitting here. So these are not your final results. You're going to continue to heal. I would suggest when you get your post-op treatments, have them focus on carving out and cleaning out this congestion in your lower back area, your sacral area, so you'll have even more defined results. Because when you turn to the side right here, it gets stuffy and congested right here when you should be killing them. You kill them in the front, you gotta have you killing them in the back, have them clean this area out, move it towards the front, and then scoop it up towards your axillary.
Okay. Awesome. Thank you.